a very participatory conversation. Welcome to this technical meeting where we will talk about local and international procurement, when and how to manage these processes and overcome common challenges based on your country context, regulations, and limitations. If you attended our previous meeting on prepositioning health products, procurement has a direct link to prepositioning supplies. The efficacy of this function requires deep knowledge of laws and regulations in country, procurement experience, market intelligence, and the ability to connect these procurement activities with other supply chain management functions. Effective procurement eventually will determine how fast and effectively you will deliver health products to the last mile. So today we will be recording this session for those that are not able to join, and we will share it along with the speaker presentations after this meeting. Today, I'm joined by my colleague, Nora Quesada, and together we will facilitate this meeting. Nora, can you please introduce yourself?
You're muted. Thank you, Annabella. Good morning, good afternoon, good evening. My name is Nora Quesada. I'm a senior technical advisor at JSI. I've been working in international development for several years in the fields of reproductive health, commodity security, supply chain capacity building in Asia, Africa, and Latin America. And I'm sending greetings from to you all from Bogota, Colombia, South America.
Thank you, Nora. And I am Anabela Sanchez. I live in Guatemala, and I have been working for several years now as technical advisor on supply chain management, health system strengthening, and health advocacy as well. So we're happy to have you with us and look forward to a great meeting. Back to you, Nora.
And today we are delighted to welcome Ehab Al-Ashqar, who knows how critical it is to carry out efficient and timely procurement processes as part of rapid response in a humanitarian emergency, and to find solutions that will provide immediate relief to people who may be facing a life-threatening situation. Ehab, please introduce yourself to the audience, and welcome.
Thank you very much all. My name is Ehab Al-Ashqar. I am a Medical Commodities Manager. I am joined IMC in 2014. I'm working starting from the field in the MMU and static clinical as a pharmacist. Then I promoted to the pharmacist officers. In 2016, I worked as a senior pharmacist officer and then country medical committee managers in 2018. This gradual promotion and transition from the field to the higher management and supervision level provide me a unique understanding of the pharmaceuticals change operation management, a clear knowledge of the different requirements and capacity to undertaking planning, management, and of course, resolving all the issues that I had during my work.
Thank you, Ehab, and we're very excited to have you. And thank you for your time and looking forward to what you're going to share with us in the next few minutes. And before we start, we wanted to remind you that to introduce yourselves in the chat, say your name and where you're coming from. Also, rather than waiting until the end of the presentation, please feel free to raise your hands and we'll open up your mics so that you can interrupt at any time and ask your questions, because we want this session to be as participatory as possible. It's a conversation actually that we want you to have with our expert Ehab today, and so please just feel free to interrupt at any time and using the Q&A for your questions and the chat just for introducing yourselves. Sorry. Okay, so back to you, Annabella.
Thank you, Nora. We would also like, before we pass the microphone to Ehab, to mention that this meeting is possible thanks to the support from the USAID Bureau for Humanitarian Assistance Capacity Building Program. This program is implemented by JSI Research and Training Institute, and the program includes a variety of support activities like developing training curriculum, developing case studies to share with all the humanitarian partners, supply chain capacity building activities that I'm sure some of you in the audience have already been part of. And very important to share learnings with regional and global communities like we're doing in this meeting. Also support partners in sharing this learning and introducing it to the current policies and procedures of the organizations. We also don't want to skip the time and the opportunity to tell you and remind you that we have a community of practice as well. It's called Humanitarian Commodity Logistics. I know that some of you are already part of it, but those that don't, please join us. We will share the link and the presentation after this meeting. It is a very important community. We are approximately 500 members so far from 75 countries from diverse backgrounds, and we regularly upload resources, these webinar presentations as well. So we invite you to be part of our community. So without further ado and announcements, I will the floor is back to you, Nora.
Thank you, Annabella. So as we mentioned before, in this technical meeting and conversation, we will have the opportunity to hear from Ehab on his experience on the ground and the tips and recommendations he has for all of us in procurement. I would like to remind you that during the course of the presentation, please feel free to request to raise your hands, and we'll open up your mics for you to ask your questions. So we want, as I said, this meeting to be as participatory as possible. So Ehab, welcome again, and the floor is yours.
Thank you very much. Today, our presentation regarding the local and international procurement. IMC, let's go to the first slide, please. Yes. Overview for IMC, International Medical Corps. IMC consider a preeminent first responder. The speed save lives. Team arrive within the first 72 hours. More than 7,000 staff. More than 90% of those staff are local, working for the 37 years. More than 80 countries on 6 continents. We have different services: emergency response and preparedness, health service support, family and community health, women's and children's health, mental health and psychosocial support, water, sanitation and hygiene, nutrition and food security. International Medical Corps in Iraq mission, among the first international NGOs to establish humanitarian program in Iraq in the wake of the 2003 Iraq war. We support national emergency efforts against the COVID-19 pandemic in the country. IMC provides integrated primary healthcare services alongside MHPSS, GPV, community health outreach services via medical mobile unit and clinics, static PSCC mainly in the camp, supported DOH PSCC. In 2020, we provided 10,140 consultation. Starting for overview procurement process in Iraq. International Medical Corps adhere to the applicable procurement procedures based on the overall PR value when soliciting bids. International Medical Corps adhere to the donor requirements. The thresholds must be followed. International Medical Corps uses negotiated procedures for all purchases of pharmaceuticals, medical supplies, medical equipment, and must be purchased from the pre-qualified vendors. Medical commodity and planning for procurement improvement project, which is called MedSip, aim at sharing work order with the PPA vendors for planning purpose with faster delivery.
Yeah, Ehab, I have a question. It is interesting that you mentioned that IMC adheres to donor requirements. Can you briefly explain what donor requirements you need to follow in order to procure pharmaceuticals, either locally or internationally?
Of course, like for the international procurement, we adhere to the all requirements, like all agreement for the all pre-qualified suppliers. As example, IMC purchase or procure medication from the donor pre-qualified suppliers, which is those international suppliers. This number one. Number two, we adhere to the all requirements in regard to the procurement. Like in Iraq, as example, for a pre-qualification for the medical suppliers, International Medical Corps uses internal pre-qualification procedure to vet and pre-qualified local wholesaler vendors and monitor their performance. In order to ensure the quality of the medical commodities we procure and distribute it to our beneficiaries, IMC in Iraq strictly follow this internal procedure to not only thoroughly assess and pre-qualified local vendors, but also properly documented and record data related to their ongoing performance. All medical commodities, including pharmaceuticals, medical supplies, medical equipment, laboratory supplies, and laboratory equipment, as well as rehabilitation equipment and others, nutrition supplies, will be procured only through licenses, registered and pre-qualified vendors as per our internal guidelines and the proper donor approvals.
Thank you, Ehab.
Talking about the long-term agreement, fixed price agreement, for the local in Iraq mission, there is unfortunately no capacity of the market vendors to maintain guaranteed terms, condition, and fixed prices over the long-term agreement. However, there is a possibility to procure pharmaceuticals, medical supplies, and medical equipment via long-term agreement from pre-qualified vendors.
Ehab?
Yes.
This is a very interesting topic, one that people usually have also mentioned some challenges. So in your experience in Iraq, what is one advantage and one disadvantage of these agreements? Can you share with us?
Yes, we included in our slide, so we are going to talk about it in details.
Okay, great. On.
So when we are going for the local procurement, when we have short duration of the project, in emergency response, rational national restriction to import medical commodities, long time of delivery from the international procurement due to the stock out, maybe emergency, like as example in COVID-19, and also when installation services are required, especially for the medical equipment. Talking about the pros and cons for the local procurement. The pros of the local procurement, short lead time compared with the international procurement, provide installation and maintenance service for the medical equipment, direct delivery to the site. The cons for the local procurement, lack of the commitment to delivery times agreement, failure to provide valid licenses and registrations, poor quality of the offered items, lack of capacity to provide wide range of the medical commodities.
It's very important when you talk about local procurement. We have seen how important market survey is. You know, like how do you do market surveys, analysis where you can map suppliers, especially when you talk about the disadvantage, so to speak, of the quality of the products that you just mentioned. How do you do this market survey in Iraq? Can you give us or
Okay,
expand?
as I already like mentioned, or IMC, we have our internal pre-qualification process for the medical supplies, medical equipment, and for the medication. Usually there is a committee from IMC. They are doing a visit to the site, to the local market, and assess the vendors. And according to the, like, there is like internal procedure that specific for IMC, they are pre-qualified those suppliers to be as suppliers that they can provide IMC, which we ensure that those suppliers are within the minimum standard requirement regarding the registrations, licenses, the warehouse standard condition. So we did this visit, and also we develop like for like as example, when we visit like a suppliers and we found a simple issue he have, we advise those suppliers to develop their warehouses or their requirement to be a pre-qualified suppliers. So in addition, like for us, we have an internal procedure to have pre-qualified suppliers in Iraq. Also, we develop the internal issues that they have, those suppliers in Iraq, so they have at least minimum requirements, so we can consider them pre-qualified suppliers.
Yeah, and Evarist has a similar question. He wants to learn more about vendor qualification requirements and processes in IMC. I don't know, Evarist, if your question has been answered, or if you want to open your microphone and ask a more specific question. And also Mona is asking, what are the basis of pre-qualifying suppliers? How do you pre-qualify suppliers, she's asking.
As I mentioned, like this is like a long procedure with IMC. There is like internal procedures, specific stages, specific steps for each stage to check the licenses, registration paper, warehouse environment, and all the document that necessary to allow these suppliers to be work inside the Iraq.
Okay, and you mentioned, Ehab, that you follow donor requirements, and Monica Lai from UNFPA is asking if you follow international standards or local standards.
Of course, we are follow the international standards. In addition, like for the local market, we follow the international standards. But in addition to that, we should also follow for the local procurement the national standard requirement. I mean, those suppliers should have alliances from the national MOH to be working, and should be provide those items to the private sector or even public sector.
Great, and well, you're generating a lot of interest, so we have a lot of questions, Ehab. Greg Roche is asking, how often do you requalify the pre-qualified suppliers?
Usually, we did pre-qualification on 1 year, and then we have mid-assessment after 6 up to 12 months, and should be also can be extended according to the situation. As example, we did the pre-qualification, and then COVID crisis has become. So we did extend for those pre-qualified suppliers for 3 months until they can provide us with all document necessary that allow them to purchase, allow them to import and also to buying medical commodities in the private sector, that including the NGOs and even the public sector.
Okay, great. And
Laura?
yes.
There are also comments and questions on the chat, and I don't know if we should post them. And one of the questions and comments are that there are raised, that there are hands raised, but I don't know if we can activate them. That's one comment. But also, I don't know if you see the raised hand in order to.
Hello, Annabella. This is Daniel. There's a question from Ming Tai with the raised hand. I will unmute.
Okay. Great. So can we listen to who is the one that is raising hand, because I cannot see that.
Ming Tai.
Okay. And we also have questions in the chat. Shall we post some of them?
I'm going to ask one of those questions. Just it says, can IMC share their list of pre-qualified suppliers with other NGOs? Whether they do you all share your pre-qualified supplier list with other NGOs that are active in Iraq?
Yes, of course. Like usually, like others NGOs, they are requesting to share the pre-qualified suppliers with them, and we did, and sometimes even like for the new area that we are going to working inside it, we ask others like NGOs to share with us the pre-qualified suppliers. Like we already asked like WHO, we ask others like MDM NGOs in Iraq to provide us with the list of the pre-qualified suppliers, so we can go and also we can include them to our suppliers.
Thank you.
Yeah, and there's a very interesting question related to that from Chiyoke. When you say local procurement, do you mean locally sourced foreign items or local items or locally procured items?
Locally procured items.
Okay, great. Also, what is the composition of the IMC team performing the technical visits in order to pre-qualify local suppliers?
As I told you, like there is like a multiple questions, multiple requirements. We are ensured that those suppliers are within the WHO standard requirements. So then we can consider these suppliers as pre-qualified or not. And also, as I told you, we can ask the suppliers to complete other missing requirements, so we can consider him after maybe complete all the missing points, so we can consider them pre-qualified suppliers.
And the team, what capacity does the IMC team have? You know, pharmacists, or who
Yes.
are the?
We have a committee. We have
Okay.
a committee. This committee from different departments, and of course there is a pharmacist and a medical doctors, and one from logistic procurement managers, and from finance also there is one from the finance. So there is a committee from the from inside IMC, from each department, and we of course ensure that we have a pharmacist there in this committee. In addition to that, this committee the proper training before going to the visit from our GPSU, which is a global pharmaceutical service unit in our DC Washington.
Okay, so you seem to resolve the issue of poor quality by having a strong team pre-qualifying local suppliers. Jason mentions that the poor quality of medicines offered is a great concern, and you put it as one of the cons in your presentations. So how do you overcome that, the poor quality of products, when you do local procurement?
Yes, as I mentioned, like in my speaking about the qualities, you know, like most of the suppliers in all area, and especially in Iraq, they are wanted to buy, and by the end, if the more than one over that pass the technical evaluation, we will go with the lower price according to our procurement procedure. So what we asking the suppliers usually to provide, if they have like more than 2 or 3 option in his quotation, so he can provide multiple options with the same offer and with all specification for the other items. And as we, a technical unit, we decided which one it is with our minimum standard requirement, and according to that, we accept that. This is stage number 1. Number 2, we did also visit to the supplier warehouse and check the quality of the items. And number 3, during receiving the items at the warehouse level, we check the quality of the items and the important things from our side. For all accepted items, we should have national approval from the KMCA, which is Kurdistan Medicine Control Agency, or from the NCDCR, which is National Center for Drug Control and Research. Those two, both center, one located in the federal Iraq and the other center, which is KMCA, located in the KRI, are responsible to give approval letter to use those medication or either supplies inside the Iraq. So whenever we have approval from those two agencies, that's mean that those item has been checked at the national level and we can use it safely. And in our stage at physical receiving those items, there is another committee that check the items at the warehouse level and comparing the all approval letters from the national agencies with the physical items and check the quality of the items, and then provide the technical feedback to the suppliers.
Great, thank you, Ehab. And we have Matini. She raised her hand, and so we'll open up her mic.
Thank you very much. I have a question. When you do pre-qualification, how you ensure that your pre-qualification criteria is aligned with national pre-qualification criteria? Because what we see sometimes is that in UNFPA, we have our own pre-qualification criteria, and then we approve some products to be import in the country, and then it appears that the government has other criteria, and then we try to find a solution how we ensure that we have. How do you solve these kind of issues to ensure that you have the same, you are aligned with the government?
Okay, nice question. So, you know, our standard criteria for the pre-qualification, it is international for the all countries. In addition to that, like there is specific topics in our criteria that we should follow the national criteria regarding the registration, licenses, working of those suppliers. So there is a lot of requirement at the national level. We already follow all those requirements and criteria, and both for the national and the international requirement, we should have it, put it all in one set, and then we approve those suppliers to be one of the pre-qualified suppliers.
Thank you, Ehab. So we may continue with the next slide.
When we are doing international procurement, international medical corps always give a precedence to international procurement from the universally recognized and donor approved international suppliers. And also we do international procurement for the long duration project, more than 6 months. And in addition to that, when the cost of the local procurement is higher than the international procurement, consider also the landed costs. And we do also the international procurement when donor regulation do not allow for us for the local procurement. As example, for the PHA, we did the international procurement for the medicine because it's not allowed to do local procurement for the medicine under PHA. The pros and cons for the international procurement. The pros ensure better quality of the medical commodities. Cost of the item is less than from the local market, and especially for the medication. More suppliers, more competition. The cons for the international procurement, transportation cost is very high, long lead time, which leaded to the delay of the supplies of pharmaceuticals to the project, difficult to install and maintain medical equipment. Talking about international procurement under PPA, which is blank purchase agreement versus non-blank purchase agreement international procurement. Under PPA, short lead time, prices are already arranged and the stock are available. Under non-PPA, long lead time, which lead also to delay of the supply pharmaceuticals to the project. The prices are fluctuated. Stock on order, after order they providing the stock, and also a variable shipping cost.
There's an interesting question here you have from Bobby Ken. Why donors like international procurement on their finance project, although the local procurement take less time than international?
There is like multiple points about that. The most important things from my view, which is the quality, you know, especially for the medication, the quality is very important, because whenever we import any medication, you should keep the environment storage for those medication at the standard requirement. At the local level, sometimes we are not ensured that the local suppliers are already follow the international requirements regarding the storage environment of the medication. Talking about the framework contract, long-term contract, and master price agreement for the international procurement. The pros for framework contracts ensure better quality of the medical commodities, as I say. Cost of the items is less than the local market. More suppliers, more competition. The cons for the framework contract in the international procurement, transportation cost is very high, long lead time, difficult to install and maintain medical equipment. Lack of a price consistency in master price agreement. During some extreme emergency or long duration emergency, such as COVID-19, demand decrease for the medical commodities, which affect the prices. So within our proposal stage, we increased the total estimation by about 30% to cover non-expected circumstances for both goods and shipping costs. Noura, I think you missed the last, the previous slide. No, not this one. Yes, this one. So there is
This one,
yes,
right?
this one. Yes, this one. Yes, yes, that's right. For the framework contracts, long-term agreement and master price agreement in the local procurement, the pros reduce lead time and administrative costs for orders, negotiated quantity volume, related discount unit prices, satisfy recurring procurement requirements with one solicitation process, benefit multiple projects. The cons for the framework contracts in the local procurement: lack of the pre-qualified vendors, that they have ability to have this agreement, limited availability of the requested items, non-stability of the exchange rate between the USD and IQ dinar, no benefit in case the list of the items frequently changes. There is some like simple recommendation to my colleagues, like we should use various pre-qualified suppliers as much we can. This result in more options for us. We can choose from them better quality and more suitable delivery according to our needs. Use local procurement for short duration project and an emergency. Use international procurement at the stable development stage for cost effectiveness and better quality, and use mid-step procedure for procurement planning.
Great. Thank you, Ehab. And we have a lot of questions. One of the questions is, with COVID-19 disruptions of flights, how did IMC manage shipments procured internationally?
Sorry, can you repeat the question? I didn't hear you.
With COVID-19 disruptions of flights, how did IMC manage shipments procured internationally?
Yes. Usually for that crisis for COVID-19, we have we did a multiple airplane shipping from the different countries, and I know like there is a lot of the challenges that face, especially during the emergency, but we managed that. We get all the items in a time and our time frame, and we did a local procurement for some PPE items, so we can have two procurement, one for the local, so we can immediately respond to the emergency, and once international procurement. So we have two procurement plan, one at the local level and second at the international level. For the international level, we consider the delay and the emergency that happened, so we did a local procurement. So during the lead time, we use the local procurement items until arrive the international shipping to the last mile.
Great. And so maybe it's time to ask you, what pharmaceutical products do you procure internationally versus locally? Because I think that this is a critical issue here.
Like usually for medication, we did the procurement internationally for all items, and for the medical supplies and medical equipment, because we saw at the Iraq mission, there is a capacity for the local suppliers to provide us with the good qualities and also fast delivery to the delivery points. So we depend on the local suppliers to provide us with the medical supplies and medical equipment. And for the international procurement, we use we procured medication from several suppliers.
Okay, so the advantage that you had is that you pre-qualify suppliers beforehand, so that when there's the need to procure either locally or international, you already have pre-qualified suppliers, right?
That's right. That's right.
Okay. Go ahead, Annabella.
There is a comment here about from Everest. It says, hello, the conversation is very interesting. One major consideration while opting for international procurement is the lead time. In many cases, the procurement is predicted with legal and political environment, not only for origin and final destination countries, but also all countries involved in the pipeline. We appreciate if you share your specific experience on how you navigate with the legal and political environments while processing the international procurement on time restricted grants. It was quite long, but I think it's very interesting.
Yes, okay. So as I mentioned, we use MedSafe procedure for our procurement planning. That's mean we start sharing the work order with the PPA vendors before we establish the project. Because like in our internal procedure, we can do that, so we can like conserve some time until we have the agreement with the donors. We know the available stock at the each suppliers, and we can ensure that the procurement will be start as soon as possible. This is number one. Number two, like there is like specific tips that we follow. As example, in Iraq country, there is issue of the shipping from site to site, shipping approval. It is national security shipping approval from site to site, depend on the several approvals from the MOH, from the government, from the national security. So whenever we get the list of the item with the certificate of analysis and certificate of origin, we had the distribution plan to all sites. We start a process of the shipping approval. So whenever the items has arrived the central warehouse, we have this approval, because we know that this will take a lot of time until we get it. Especially in Iraq, every time that we are going to submit for shipping approval, there is a new regulation. So what we are doing, we start the process before the items has been delivered to our central warehouse, to conserve sometimes for us that it is essential for us to deliver the medical commodities to the delivery points as soon as possible.
Thank you, Ehab. There are more questions. One from Mona. Do you pre-qualify only drugstores based on the GDP, or also local manufacturers by inspecting their sites and checking their GMP?
Usually we are a pre-qualified wholesaler only. So this is the only allowed for us to, because like IMC, they don't have capacity to check the manufacturers, because there's like should be a specific team to check the manufacturer. So we are usually doing the pre-qualification for wholesaler according to our internal guidelines.
Okay, thank you, Ehab. And Eugene says, hello, how do you handle a pre-qualified supplier who is not following proper guidelines and requirements?
As I told you, like whenever we visit any suppliers, there is a specific criteria to be pre-qualified suppliers. So when there is one or two or more points are missed, we didn't pre-qualify this supplier, and we asked the suppliers to improve those missing essential points. Then after he complete those missing, we can consider, we did a pre-qualification process for him again, and then there is we can consider him a pre-qualified supplier. So our rules here, not only just to say for the pre-qualified supplier, for the suppliers yes or no, we are working to also improve the local suppliers to maintain their requirements with the WHO standard requirement and also with the national requirements, because by the end all the suppliers, they needed to buy they needed to sell medications and medical supplies to all private sectors, including the NGOs.
Good. Before, I think that there is another interesting question from Adele. Is there an international standard tool for assessment of the suppliers, especially medication supplier? Do you have a tool, or do you know of a tool that you can mention?
As I told you, we already follow the WHO standard requirement, and also in our internal guidelines, there is a specific criteria for the requirements that we can consider those suppliers as suppliers that they follow the international standard requirement or not.
Okay.
So we have it, but this is in our internal guidelines. IMC internal guidelines.
So it's a combination of WHO and in your internal IMC guidelines.
And there's a question related to that from Melanie. Do donors recognize your internal pre-qualification process, or do you use unrestricted funds for these procurements?
No, usually the donor, they know about the pre-qualified suppliers for this. We have our unit in the GPSU. The rule of this unit to ensure all the procurement are from the pre-qualified suppliers, and all the agreement or all the approval for the pre-qualified suppliers came from our GPSU, which is a Global Pharmaceutical Service Unit in Washington, D.C.
Okay, somebody else asked, how do you mitigate the issue of long lead time for the international procurement?
As I mentioned, we already start mid-SIP procedure before we got the approval for any for the proposal, for our proposal. So according to that, we reduce that time, the lead time, because we shared our work order with our PPA vendors.
And do you also partner with agencies like QAMED when doing local supplier pre-qualification?
Sorry, I didn't hear you well.
Do you partner with agencies like QAMED when you do local supplier pre-qualification?
No, usually we did our our part as IMC. We didn't partner with other parties.
Ah, okay, great.
This is Nadia, just to jump in. I think a lot of the NGOs and even IMC at the global level, sometimes they do get information from QAMED, and people can Google QAMED to find out more. And they do market studies, and they identify suppliers in countries. Sometimes they'll do a market study for multiple NGOs at the same time. Thank you so much.
Yeah, thank you. And Bashir from Nigeria is asking, are there restrictions by government on importation of pharmaceuticals? And if yes, how does that impact the programming or the program?
Yes, there is some restriction about, as example, the duration of the expiry date. We should have more than third part of the shelf life. This number one. Number two, there is some restriction about the country source of the goods, of the medical commodities. So usually whenever we have RFQ or we have purchase order, we already mentioned that in our reputation, like we should exclude the source from those countries because there is national restriction to import it from them. This number one. Number two, the expiry, we should have there 3 to 4 from the remaining shelf life. So there is some restriction, but we managed that during the RFQ stage and during starting of the procurement process.
Okay, and how, somebody is asking, Rima is asking, how do your quality assurance specifications differ from the WHO requirements?
Quality assurance differ from the?
Yeah, your QA specifications, how do they differ from the WHO requirements? If they differ, if they are different.
Like for us, for the quality assurance, we, as I told you, like we follow all the WHO requirements regarding the quality assurance, starting from the manufacture those items at the international suppliers until we receive those to the to dispense those to the beneficiaries. So we follow all the WHO requirements to ensure the quality assurance of the items.
Great. And okay, someone says, Ehab, nice presentation. What has been your experience in international procurement in regards to government regulations with customs and pharmaceutical regulations?
Yes, usually like there is a specific requirements at the Iraq level for the international importation for the medication. We follow all the requirement, which is we should provide the certificate of analysis and certificate of origin. We should avoid some restricted country source of medication. Also, we should follow the allowance of the remaining shelf life for importation, and then after we follow all the national requirement, we submit a request for to the national MOH that allow us to import medication from the international source. So we follow all the requirements, and we prepared in that in advance. So we know all the requirements. We already follow up on regular basis with the MOH and the national pre-clearance department regarding all the criteria that needed that allow us to import medication from outside Iraq.
Great. And somebody wants you to emphasize on the benefits of local procurement.
Yes, the local procurement from our side, as I said, short lead time, because there is two things. You know, for the international procurement, there is shipping approval. After that, there is a pre-clearance approval. Then there is a shipping approval from the central warehouse to the last mile. But in the local procurement, we have short lead time compared with the international procurement. This number one. Number two, the most good points for us, which is delivery directly to the site. The most challenge that we have in Iraq, as I mentioned, it is the shipping approval from area to area. It is very restricted. There is a multiple agency inside Iraq that ask you to provide all the document, all the requirements that allow us to move medication, and also they give us the allowance in a specific time, and every time the regulation has been updated, so we needed to follow that on regular basis. So the local procurement, it is the best advantage for us two main points. Number one, short lead time compared with the international. Number two, the direct delivery to the site. So whenever we requested any items, will be shipped after 1 or 2 weeks maximum to the site directly.
Okay, Ehab, there are more questions.
We have Abdul Qadir, who has his hand raised. If you could ask this question.
Yes.
Okay, thank you, Daniel. Thank you so much. This is Abdul Qadir from IMC Sudan. I am a medical warehouse officer. Thank you, Ehab, for the nice presentation. It's really very interesting topic and very important. I am just asking about the quality control at the level of the warehouse.
Yes, the quality control we have. Sorry, can you hear me? Yes, now. Good. The quality control, there is a specific technical person in addition to the warehouse person. They have their checklist to ensure the physical change for the items at the warehouse level. And as I mentioned, they comparing the batch number, expiry date with the national approval letter, which is from KMCA, Kurdistan Medicine Control Agency, and National Center for Drug Control and Research. Those the two agency in Iraq, the only agency in Iraq, they can provide you the quality check, so we can use those items in the private sector. So whenever we had those documents, we should compare the items at the warehouse level with those approved letter. They contain the specification for those items. We compare it, we check the items, and also in addition to that, we have our internal checklist for the items. When we deliver to the warehouse, we check the physical appearance, we check the expiry, check the batch number, compare it with the purchase order. If everything is fine, we give the approval to receive those items. In addition to that, we have another advanced quality control, which is required from us to check the items. Like for the medical equipment, as example, we should check 100% of the items. Like every single unit of the medical equipment should be checked and should be compared with all the letters, all approval letters, so we can then give the approval to use those items inside IMC.
Ehab, we would like to continue on and on and on, but I know that there are other meetings coming up, and we really thank you for your time, for the great discussion. Thank you, everyone, for all the questions. We, due to the time, we could not answer all of them, but we're gonna make sure to have a follow-on meeting with Ehab to make sure we address all of your questions. We know how critical procurement is. If procurement is not done timely, the rest of the supply chain suffers. So we are so grateful, so thankful, and it's time to wrap up, and I'll pass it on to you, Nora and Nadia.
No, thank you, Annabella, and thank you, Ehab. Thank you, everyone who participated so actively in this conversation. That's what we're looking for, the interaction with the expert that we have today. And we really appreciate your time and effort to be with us today. Thank you, Ehab, for your wonderful presentation as well. Nadia?
Yes, thank you, everyone. Thank you, Ehab. It's wonderful to see practical experiences, and it's great to have a technical discussion rather than just a one-way presentation. We tried to change the format so we can have much more time for discussion, and it seems to go well. Thank you, Ehab, for being prepared to answer any question that was thrown to you. It was a remarkable feat of experience. Thank you.
Yes.
Thank you.
Okay,
Thank
so Yeah, we'll see you next time. And thank you so much. Have a good day, good afternoon, good evening. Bye.
Bye, everyone. Be safe. Take care.